this, yeah, there we go. All right, so if we flex the wrist, we typically, on a typical person, will see 3 distinct wrist creases. We have a proximal, a middle, and a distal. Okay? The distal crease is the proximal crease here is the proximal most excursion of the synovial sheaths of the wrist flexors. So if you have somebody that has a diagnosis of synovitis, it's not going to go much above that crease. Okay? The second crease here, so the middle crease, is going to be the proximal most component of the flexor sheath, retinacular sheath. This will also tend to be the base of the radius and the ulna. That's second line. Okay? The distal crease here at the base of the wrist is going to be the proximal most edge of the carpal tunnel. Okay? Now, if I start on this distal crease, just at the base of the thumb, right here, is the tubercle of the scaphoid. Okay. If I go across to the lateral side, the ulnar side, I guess technically that's the medial side, isn't it? Yeah. So the ulnar side, we'll call it that. We're going to run into the pisiform right here. If I follow the thumb, right, coming up from the scaphoid tubercle, we'll find another ridge right there. That is the trapezium. Okay. Now I want to go parallel to this line here, up this way, to find the hook of the hamate. Right there. Okay. Now if I box this off, that delineates, this box here delineates our carpal tunnel. Okay. So if you have a patient coming in complaining of tingling in the fingertips, this is where you want to do a Tunnel's sign. Okay. Right here between the hook of the hamate and the pisiform is Guillen's canal. Right, so this is where the motor fibers exit for the hypothenar eminence. Okay, it is not where the sensory fibers enter the wrist. Those branch off well up the forearm. Okay, so you can't get tingling or numbness from a Guillen's canal issue. You also can't get palmar numbness from a carpal tunnel issue. Right? Superficial palmar branch, the median nerve branches off way up here and goes over the top of the carpal tunnel. So the only one that goes through there is the digital branch. Okay, good to that? All right, now, this is where things, because this is going to be the typical view you're going to have of the wrist, right? Typically, we're going to be looking at it from the dorsal aspect. So, we like to start from big landmarks, right? So for me, the ulnar styloid is the most consistent here, right? We come off the end of the ulna, laterally, to the ulnar side here, we're going to run into that bony prominence protruding toward the wrist. That is the ulnar styloid. Okay. Deep beneath this is going to be the TFCC disc. Okay. So if we radially deviate, ulnarly deviate, we're not going to really be able to appreciate this ulnar disc in most cases because it's going to be blocked off by that ulnar styloid. Now there is a situation that we'll talk about a little bit later where this thing will actually sublux and shift laterally where you can actually appreciate it. There's actually a technique to correct that. Okay, but what we can do is if we slide dorsally, there's a soft spot there where we can appreciate the ulnar disc. Okay, so there's bone, there's a soft spot. If we need to, we can flex and extend the wrist, feel it press into the tip of our thumb right there. Okay. If we just move barely proximal to that, barely distal to that, we're going to run into the triquetrum. Okay. Again, we can flex and extend. If we extend, it should disappear. If we flex, it should pop into our finger. Right? This is concave on convex, so it's going to go opposite of the direction of the wrist. Okay. From there, we're going to slide more distally. There's a little depression in between here. And right there, we're going to run into the dorsal aspect of the hamate. Now we can work around if we want to double check our position, get onto the hook of the hamate, and then we can flex and extend and feel the bone moving back and forth. Right? We can even fold and fan the hand to appreciate movement there. Okay. If I move medially here, we're going to run into a nice big bump. We could also locate this by following the third metacarpal down until it drops off into this divot, which is where the capitate sits. Capitate's a big, almost circular bone, articulates with all of the other carpals. Okay, so flex and extend it, feel it go into the groove, feel it pop back out. Okay. From there, we are going to go more proximally again. There's another groove here. That's the joint between the capitate and the lunate. Okay. So there's our lunate. Again, if we extend the wrist, it should disappear. If we flex the wrist, it should pop into our fingers. Okay. I'm going to move more radially here, and there's a very distinct drop off here. That's going to be where our scaphoid rests. Now, depending on the position of the scaphoid, we do see it palmar scaphoid quite a bit. There may not be much to appreciate here on the dorsal aspect, but we can find it certainly in the anatomical snuff box with radial and ulnar deviation, and we should be able to find it just palmar to the thumb. Okay. If we slide distally again, we're going to come across this very thick, very prominent bump. This is the trapezoid. Right, this is going to be right at the base of the second metacarpal. Okay. From there, we're going to slide toward the base of the thumb, and we should appreciate a joint now in an oblique plane, right? All of these joints previously have been very much in the sagittal plane. Now we're going to get into an oblique plane here. That's going to be the trapezium. Okay, so trapezoid, trapezium. Okay, just distal to the trapezium, we will run into the first CMC joint. Okay. That's it. Nothing terribly complicated. I want you guys to have a good idea about these different landmarks on the palmar side. Okay, so see if you can outline your carpal tunnel, find the wrist creases, flip to the back side here, and work on palpating the different carpal bones.